Pain, burning, numbness, tingling, cramping, and imbalance are the common symptoms associated with peripheral neuropathy. Now, up until now, you've been led to believe that there is little that can be done other than taking Neurontin or gabapentin or any other type of medication. One of the biggest lies I hear patients being told by their doctors is that you have neuropathy and there's nothing you can do. Whether you've been diagnosed with peripheral neuropathy, diabetic neuropathy, chemotherapy-induced peripheral neuropathy, or any other form of neuropathy, I'm here to tell you that I have and I continue to help people either reduce or totally resolve their pain, burning, numbness, tingling, cramping, and imbalance, which then allows them to get back to enjoying their life again. My degree is in chiropractic, but what I utilize in my office is chiropractic neurology, functional endocrinology, brain-based therapies, and nutrition. Now, I became board eligible in chiropractic neurology back in 2006. This extra postgraduate training, along with my 22 plus years in practice, is what allows me to get results where other chiropractors, medical doctors, neurologists, and endocrinologists have offered little to no relief. I've met with hundreds of people who suffer with peripheral neuropathy, so I know what you're going through. Your symptoms may be in your feet, in your hands, or even both. Perhaps you can't sleep at night as a result of the burning and pain. It's possible that your feet are so numb that you no longer feel them, and now you're more prone to losing your balance and falling. And this often leads to the use of a cane, walker, or wheelchair. Usually what I hear from people is that the medications that were prescribed will perhaps often, take the edge off, but its effectiveness then tends to wear off in time. Many people are concerned and ask, well, what am I going to do if this gets worse? The reason I've been able to help people with neuropathy where other doctors have failed is because of my unique approach. I use a two-pronged approach to reducing and removing the pain, burning, numbness, tingling, cramping, and imbalance associated with the different neuropathies. First of all, you need to understand that there are many different causes of neuropathy. The most common are diabetes or having a history of blood sugar imbalance, having a history of a bad back or a neck, certain medications such as chemotherapy or cholesterol-lowering drugs. And the last category that I'll touch upon is they'll talk about either being genetic or an autoimmune type of neuropathy. Now, once you get a good understanding of what the cause can be from, then there are specific measures that can be done to stop any further damage to your nerve receptors in your arms, hands, legs, and feet. The other part of the solution is that we need to increase the function of the nerves and nerve receptors so that proper sensation can be restored back to the hands and feet. Now, there are many different therapies that I offer, and I can promise you that I do not use a cookbook approach in dealing with cases of peripheral neuropathy. Your specific exam findings will determine the best therapies for your specific case. My goal is to restore normal sensations into your limbs as quickly as possible and to maintain those normal sensations for the rest of your life. Now, I can't guarantee that everyone I meet with will get better. That's why it's important for me to meet with you so that I can determine if I think you will benefit from the care that I offer. My recommendation for you is that you call the office today for a $27 screening so that we can sit down, discuss your specific case, and I'll perform a set of non-invasive tests to determine if you qualify for this type of care. I'll then be able to sit down with you, explain what types of further testing is needed, as well as the type of care that will be recommended. I'll talk about the cost of the care, and I'll answer all of your questions for you. This will give you the best opportunity to learn all that is necessary for you to get the necessary results to overcome your pain, burning, numbness, tingling, cramping, and imbalance so that you can get back to enjoying your life again.